Hi, my name is Adriel William, and in today's video, I'm going to be talking about an interview type called MMI. So, MMI are multiple mini interviews which are conducted by a lot of dental schools, medical residencies, schools like University of Michigan, University of Minnesota. Last year, when I was giving an interview to USC, they took an MMI, and even I believe the way Casper work is similar to an MMI. So let me explain why more and more schools are inclined towards MMIs rather than conventional interviews. So most of the time in an MMI, they give you a question on the screen, give you a limited amount of time to prepare for it. For example, it might ask, tell us about a time when you failed. You have 1 minute to prepare, and then you would have 2 or 3 or 5 minutes to record your answer, depending on how much time they give. So then they record your answer, and then they have this file which is analyzed and evaluated by a group of people, and they figure out whether you're a good fit for the school or for that institute or not. And what I'm going to try to do is try to help you out with some points or things that you should consider when you're preparing for MMI as compared to a conventional interview. So in MMI, for example, when I was giving USC's interview, the question could range from it could range over a vast topics. For example, it could be an ethical question, it could be a personality test question. For example, I had a question that one of your employees lost a USB which had all the patient data record, and this is a confidentiality issue. And they asked, what would you do in this situation? And they gave 1 minute of time to think about it and then record my answer in 2 minutes. So what I would suggest, if that interview allows you, USC allowed me, I wrote down the points. So whenever they show you a question and they give you time, write down the main points. Point number one, for example, in this case, I said, number one, I want to talk to that employee, that why did he took the patient data in a USB and took it outside the office. It's not recommended. It wasn't necessary. So why in the first place that individual took the data out of the office? Number one. Number two, I would help the employee to go and find that USB. Maybe that person lost it in his car, or maybe outside the office, or in a bag in a storeroom, somewhere like that. If I could help them, I would do that. Number third, the point I wrote down was that if we can't retrieve the data, then if we can't retrieve the USB, we have to inform the concerning authorities, because it's a state or federal crime to lose a patient's personal data, which can be used in a lot of criminal activities. So third point was inform the concerning authority, and fourth point was that you have to inform the patients as well that your data has been lost and it can be potentially used for any malignant activities, so they are well informed about it. And on the last thing, my fifth point was that I would want to make sure that this doesn't happen in future, and we create a process or we create a system that these kind of errors can be prevented. So the reason I'm going through this answers is to let you know how to think about ethical questions. You have to think in diverse ways. First of all, when dealing with problems, never be judgmental and say, I will just fire that person and put that person in jail. Do not have that kind of aptitude. Have different line of actions, number one. The second thing is use points. I didn't write the whole sentence. I just wrote one word for each point. So I had them in my mind. Second thing was that now I had to figure out that I have to answer this within 1 minute or 2 minutes. If I'm given 1 minute, then most probably I won't be able to answer or give all 5 points. So I might just give 2 points or 3 points. You need to make sure, and I usually recommend candidates for MMI, if they give you 1 minute to give your answer, plan it to keep it within 45 seconds. If they give you 2 minutes, plan to keep it in a minute and a half, because what will happen while you're taking a minute and a half, it will end up being in 2 minutes. The second thing is, most people think that during MMI or recorded question and answers, if they give us 3 minutes, we are supposed to give an answer throughout 3 minutes. We have to utilize all that time. That's not a very professional and I would say prudent way to answer your questions. What I suggest is that if they ask you a question and if you can answer that in 40 seconds, then don't drag it. Tell your answer straight to the point, confidently, and then don't linger around. This is a very common mistake that a lot of candidates do, and I try to suggest, recommend, and even request them that once you've given a very good, straightforward answers, do not try to explain it. Just tell what you're thinking straight to the point and let them ask you further questions if they want to. In MMI scenario, stick to the point and make sure whatever amount of time which is given to you, keep your limits below that time. If they give you 5 minutes, try to target 4 minutes, that you're done within 4 minutes. It won't harm you. If you know how to answer straightforwardly within less time, they would rather prefer you over somebody who just keep telling stories. And telling stories is not bad, but you have to keep your audience engaged. That's very important. Whether it's a YouTube video or whether it's an interview, when you're communicating, you need to keep other people engaged, or at least strive to do that. Coming back to MMIs, one other thing that is a very important point as compared to conventional interview is that in conventional interviews, you can navigate your own interview. For example, if I want to talk about basketball, or if I want to talk about hiking or any past experience, I can actually introduce that point during my interview, and then the whole conversation go towards that side if it's fascinating. And that happens all the time. You say something fascinating and the interview will ask you questions about that, any research, anything that you have done in the past. But in the MMI, you're not the one who's navigating, because it's a much more, I would say, electronic based interview. So there's already everything's fixed. So you're not navigating. They will tell you, we are asking this, you have this amount of given time, record your answer and tell us. So you don't get to navigate things. That's very important. So when you're preparing for MMI, stick to the point and be ready to answer a wide range of questions. For example, on one point, they were asking me, tell us about a time when you failed in your life, which is a very common interview question. On the other hand, they were asking me, what type of leadership do you prefer? And do you have any example of an individual that you have seen in your life? Now that's a very different question, and preparing for it, or if you haven't thought about this, jumping up with an answer or coming up with an answer within those 1 minute or like 40 seconds, it could be tough. Then they were asking me question about this patient confidentiality issue. Then I shared one of the questions on my YouTube channel about an ethical question where one of your colleague is not wearing proper attire to the school lab after hours. What will you do? You can check that video out on my YouTube channel if you want to see that. But the point I'm making is that they could be asking you a wide range of questions. And what's the solution to that? So the solution is that I would request or recommend you is to think about different questions that could be asked to you. So they could be related to your personality. And one thing you want to consider is when you're answering about your personality, for example, if you're answering about your failures or your strengths or your weakness, do not end up dragging them. You have to stay within that limit. Tell about your strength, that this is my strength, this is what I learned from it, and that's it. On the other hand, have an idea about ethical scenarios. And ethical scenarios could range over a vast field, and we need to understand what's right and wrong in Pakistan, India, or Middle East or Africa wouldn't be right in US. There are some gray zones that we need to consider. The laws are different, the technology is different, and US is one of the most litigious society. So everything comes down to the legal system. Everything is controlled by the legal system. So ethical scenarios can be difficult and can fall into gray zone. So what's the solution? The solution is to know that there's not always one right answer for ethical scenarios. And even if you don't know the answer, just show them what approach you have. For example, when I said about the USB, when the patient logged the USB with the patient data, what I told them is my approach to dealing with that problem. So this usually helps a lot. If they give you any scenario or any situation where they give you a problem, ethical problem, and you don't have a definite answer, give them multiple line of approach. I will do this on number one, then I will do this, and then I will do this. Only thing is, make sure you remain within the time zone. Other thing is, be confident, look into the camera, and when you're talking, engage your audience or the person who's listening to. And one thing that I could recommend is be familiar to the American culture. For example, if somebody's talking to you about leadership, try to give them examples which are well known from United States. For example, if you talk about Martin Luther King, or even Mahatma Gandhi is well known in US and American society, but talking about Nelson Mandela, Abraham Lincoln, or somebody which is well known to the American society. So if they ask you about leadership, I would suggest know a little bit about the culture and what's more known up here, so you can tailor your answers in a way that's more synchronized to the listener. So the most important recommendation I could give you is that practice to stay within time in front of a camera. Record your answers and see if you could answer any topic within 1 minute or 2 minutes. So that would give you a really strong command on preparing your answers. I hope this long video will help you and benefit in your preparation. If you have any further questions, you can reach out to me, and I hope you find a strong purpose in your journey towards dentistry. I will see you soon in a more meaningful video. Best of luck.